I am aware that there have been reports of serious health problems that are alleged to have occurred following HPV vaccine. I have great sympathy for any family who are caring for a sick child. However, I must stress to you this does not mean that these symptoms have been caused by the HPV vaccine. Over 170,000 girls in Ireland and up to 63 million worldwide have received this important cancer-preventing vaccine. The vast majority of reported side effects have been consistent with the expected pattern of short-term adverse side effects for the vaccine. 2 reported conditions have recently been examined by the European Medicines Agency. These are complex regional pain syndrome, which is a chronic pain condition affecting the limbs, and postural orthostatic tachycardia syndrome, a condition causing symptoms such as dizziness, fainting, as well as headache, chest pain and weakness. It should be noted that these 2 syndromes are recognised to occur in the general population, including adolescents, regardless of whether they have had the HPV vaccine. The EMA review confirms that the evidence does not support a causal link between the HPV vaccine and the development of CRPS and POTS. Therefore, there is no reason to change the way the vaccines are used or amend the current product information. My colleagues will give you further details of these reviews. Anyone in Ireland who is experiencing ill health is eligible to seek medical attention and to access appropriate health and social services irrespective of the cause of their symptoms. I would strongly advise these girls and their families to seek medical advice from their doctors and be guided by this advice so that they can have an opportunity to return to full health as soon as possible. Thank you.
Thank you. Is Mr. Connolly or Ms. Gilvary, are you making an opening remark? Okay.
Yeah.
Okay.
Well, thank you. Chairperson and committee members and parents, I'm here as chair of the National Immunisation Advisory Committee, and I've been a member of the advisory committee of the Health Products Regulatory Agency for over 20 years. And of particular relevance, I've been a paediatrician for 32 years, up to 2010, and dealing with children with chronic, ongoing, debilitating conditions. I'm a parent of 4 children, and one of my children had chronic fatigue following infection with glandular fever, which is a well-recognised cause of chronic fatigue. Now, at the outset, I want to make it very clear that I strongly empathise with children and families represented by regret. Chronic fatigue syndrome can be a very debilitating chronic condition, and nobody who has listened to the stories can help must recognise that. And I have actually met and spoken with representatives of regret. Any person in Ireland with a chronic condition should have ready access to services which can, in a timely fashion, appropriately assess, investigate and manage their problems on an individual basis. And I think if that is assured, the main aim of regret will be achieved. In Ireland each year there are over 300 cases and 100 deaths from cancer of the cervix. And the vaccine, no vaccine is 100% safe and no vaccine is 100% effective. But they are very safe and they are very effective. And I just would say that the trials on the HPV vaccines in Europe, the clinical part of the trials, lasted longer than 4 years, not 6 months, which was stated happened in the United States. So they happened for appreciably longer.
You conclude, if you don't mind, because you're over your allocated time.
Oh,
okay?
I'm very
okay?
sorry.
No,
I didn't
okay.
know.
We normally give 6 minutes to each.
Oh, I'm sorry.
Okay.
I wasn't informed
okay.
of that.
No bother.
Okay. Can you give me one moment
sure.
just to?
Yeah.
Okay. Thanks for giving me longer.
Not at all.
An adverse event is different from an adverse reaction. An adverse happens in association with the vaccine but is not necessarily caused by the vaccine, whereas an adverse reaction is. In order to determine whether the chronic fatigue syndrome is caused or coincidental, it's necessary to know the incidence of the syndrome in those who were never vaccinated, for instance, before the vaccine was introduced, and the instance subsequent to the vaccine. We do know that the numbers expected in Ireland of the chronic fatigue syndrome before the vaccine was introduced are conservatively 340 up to 680. 170,000 children have been vaccinated, so the reports that have been received, I think you said 120 or 130, are less actually than would be expected. So the reporting is, as you know, it's underreported. But based on that, there is no evidence to say that the vaccine caused chronic fatigue syndrome in these children. Thanks, Chair.
Thank you. Dr. Guevara, are you making up my statement? No,
I think Brenda's going
Brenda,
to
okay,
first.
the top one, yeah. Thank you.
Thank you, Mr. Chairman. I'm here representing the HSE National Immunisation Office, which is responsible for the coordination of all publicly funded immunisation programmes. We are responsible for training and communication materials both for health professionals and the general public. Our programme started initially for girls in first year in 21 second-level schools in May 2010. And this allowed us to ask parents if they were happy with the information and the content of the information materials that they received, and over 95% were. Initially, girls require 3 doses of HPV vaccine at 0, 2 and 6 months to be fully vaccinated. This changed to a 2-dose schedule in 2014, as new scientific evidence showed that 2 doses at 0 and 6 months gives the same protection. The target uptake is 80% for a completed course of vaccine in first-year girls, and the programme has achieved the target uptake every year since it started, with the most recent figure of 84%. Over 95% of girls who start the vaccine course complete the required number of doses, which is a great credit to the dedication of the HSE school vaccination teams. The HSE is committed to providing accurate information for parents about all the diseases, about all the vaccines to prevent them, and the side effects from those vaccines, to allow them to choose whether to give consent to vaccination. All the information provided to parents about the vaccinations is prepared from the available licence documentation for each vaccine. That is the summary of product characteristics and the patient information leaflet. The information is presented in a clear, simple language and approved by the National Adult Literacy Agency, so it can be understood by all. The language is in line with HIQA guidance, communicating in plain English, which was published in July of this year. Prior to all school immunisations, parents receive an information pack in a sealed package with an information leaflet, a consent form and cover letter. All the information booklets, including that for the HPV vaccine, include information on the most common, the rare and the very rare adverse events that can occur after vaccination. The information booklet does not include conditions that are not known side effects of the vaccine. Each information leaflet also refers parents to the National Immunisation website, where additional information, including the licence documentation, can be found. Information leaflets for the very successful UK and Australian HPV vaccination programmes contain less information than our own one on side effects, and also refer parents to websites for further information. The HSE acknowledges concerns from parents about the level of information they receive about HPV vaccine, and will take these on board to ensure parents receive as much accurate, credible information to allow them to choose this life-saving vaccine for their daughters. Thank you.
Thank you.